When treating joint pain and dysfunction, one of the first things we need to do is develop tolerance to basic movement. So if we think about the hip, for example, if the hip can't flex and extend, abduct and adduct, or rotate without hurting, that hip is going to have a lot of trouble doing basic hip things. In other words, if we don't have access to these basic motions, the hip is either going to hurt all day or movement is going to be significantly altered, as the parts of your brain that are responsible for moving and controlling your hip need to find alternate movement strategies to avoid these painful positions. So, like I said, when dealing with a painful and sensitive hip, the first thing we want to do is work towards building tolerance to basic movement. And what I'm going to review in this video is our basic hip mobility movement sequence. This is the sequence that I use for every movement sensitive hip that I see. So just FYI, to classify these patients, these would be the people who you examine, and when we assess their basic hip range of motion, it provokes symptoms, right? So pain limits their full range of motion or expression of the movements that the hip needs to perform. So with that said, let's go over the movement routine itself. And then once I've done that, I'll wrap up the video by discussing programming and progression criteria. Now, just as one final FYI before we get into that, if you are a My Rehab Connection subscriber and you use our exercise prescription software, you can find this movement sequence in the exercise group sections under the title Basic Hip Mobility Sequence, Pain Mobility Focus. All right, let's take a look at the program. Okay, the program itself is going to consist of 4 distinct exercises. And again, we're using these exercises as they essentially encompass all the basic planes of motion that the hip has to move into. So we're going to start with supine hip rotation. The next exercise we're going to review is supine hip abduction, adduction. From there, we're going to transition to a quadruped position, which is a much better position with an acute hip to train hip flexion extension. And finally, we're going to include a rotation exercise from the quadruped position. Here, we're really using 2 separate positions to train rotation, as it's going to affect different tissue if we train rotation from a neutral position versus a position where the hip is flexed to 90 degrees. So let's review each exercise. We want to keep our legs and our heels resting and supported on the floor. From this position, I'm going to rotate my legs outwards, hold 1 to 2 seconds, and then I'm going to rotate my legs inwards. I'm going to perform 8 to 10 slow repetitions back and forth. Remember, the whole legs are moving, but the motion is coming from the hip joints and the muscles surrounding the hips itself. Here, we're trying to build basic movement tolerance. That means we're going to go as far as we can, but we're not going to force the ranges or force the motion beyond what is tolerable. If we do get some symptoms, we're okay to go and touch the edge of those symptoms. But again, we don't have to force it. It should be comfortable and tolerable as we're doing the movements. So we're going to be positioned on our back. We want the leg that is affected to be extended and resting on the ground. Opposite leg is going to be raised. This is just to get the leg out of the way so we can create more motion through the hip. From this position, we're going to pull our leg inwards towards the opposite leg, hold 1 to 2 seconds, and then we're going to slide the leg outwards as far as we can. We're going to perform 8 to 10 slow repetitions back and forth. Now remember, whole leg is moving, but the motion is coming from the hip itself. Here we're trying to create basic movement tolerance through the hip joint and surrounding muscles. So what that means is as we move, you're going to go as far as possible, but you're not going to force the hip into painful or uncomfortable positions. As we move, it's okay to touch the symptoms if you have some when we're moving in or out, but we're not forcing or going deep into those motions. Slow back and forth. Feel and visualize the motion happening from the hip. Feel the muscles contract around the hip as you slide the leg and slide the foot inward and outward. Okay, so we're going to begin in our basic quadruped or hands and knees position. Here, I'm going to lift the affected hip or the affected leg slightly off the ground, and I'm going to pull my thigh and my leg up towards my chest. Hold for 1 to 2 seconds, and then I'm going to slide and pull my leg backwards, trying to bring my leg up towards the ceiling. I'm going to perform 10 repetitions, nice and slow, back and forth. Now, when we're doing these motions, remember, we're trying to build the tolerance to the hip in terms of its motion. So we want to go as far as we can, but we don't need to force the motion. If we do get any symptoms, whether it's going forward or backwards, we're just going to go to the edge of those symptoms. We're not trying to force the hip into positions it doesn't want to do, but we're trying not to avoid the position either. Nice and slow back and forth. Again, 8 to 10 slow repetitions to tolerance. Try to focus on feeling the motion at the hip, feeling the muscles around the front and back of the hip generate the motion. So we're going to begin in our basic quadruped or hands and knees position. From here, we're going to take the affected leg and we're going to rotate the foot outwards, hold 1 to 2 seconds, and then we're going to rotate the leg inwards. Now, in order to create space for the leg to move, as we come inward, we can either just keep a slight bend in the knee so we can allow that opposite side foot to pass over the stance leg, or alternatively, you could extend that back leg and allow the foot and the lower leg to rotate underneath the opposite leg. In any event, you're going to rotate inwards, holding 1 to 2 seconds, and then rotate outwards, holding 1 to 2 seconds. Now remember, we're trying to create movement tolerance at the hip joint itself, which means as we move, we're going to try to prevent the lower back and pelvis from rotating back and forth. We're going to try to keep the movement isolated to the hip itself. We're also going to limit the range if needed if there are symptoms. We're trying to build tolerance to the positions, but we don't want to force it. So if you get any symptoms in and around the hip while we're rotating inward or outward, it's okay to go and touch the edge of those symptoms, but we don't need to force too deeply into those symptoms. Keep it tolerable, should not be painful to generate these motions. All right, now that we've gone over the program itself, let's go over some of the programming and progression criteria. So first, the key with these motions is that we're trying to move to symptom tolerance. So in other words, we want to move the hip as far as possible into each direction, but we're not trying to force the hip into painful positions it's not comfortable with or it's not ready to go to yet. So we need to explain this to patients. It's really about trying to restore basic movement tolerance, but we're not trying to turn this into a no pain, no gain scenario. And the other thing to really keep in mind here is that some patients are going to be quite hesitant or maybe even fearful of moving a painful hip, especially if some of these movements will create or reproduce some of their symptoms. So here it is extremely helpful to point out to patients that these are gentle, non-weight-bearing exercises, which means the actual force and stress around the hip is quite low. This also means that any symptoms they experience, especially or at least if we are keeping the movements to symptom tolerance as we just discussed, any symptoms here are going to be the result of tissue inflammation or hypersensitivity of the tissue, as opposed to creating further tissue damage or injury. And again, these are very critical things to point out to patients to make sure that they're on board and comfortable with the exercises that we're prescribing. Now let's talk about programming. As far as programming goes, the typical prescription is going to be perform each of these exercise movements for 10 slow, deliberate repetitions. And then we're going to repeat this process every few hours. The idea here is we're trying to create a light, easy, controllable stimulus, but to provide this stimulus on a regular basis throughout the day. Now, we also want to point out here that while I like all four of these movements to be done as a full routine, because they cover all the basic fundamental motions of the hip, it doesn't mean we need to prescribe all of these motions at once. Depending on the patient and how sensitive they are, we may start with prescribing only 1 or 2 repetitions, and then we can build the program up as we go. All right, lastly, let's talk about progression criteria. Really, the primary objective that we're trying to do here is to build and restore the tolerance to these basic hip motions. Here, what we're trying to look for is the point in which motion is no longer limited by symptoms, and thus the patient or client is able to tolerate these end range hip positions. And just to clarify here, I should say that this doesn't necessarily mean that the motion needs to be completely symptom-free. For example, if the patient has some very mild symptoms, but these symptoms are very tolerable, they're minimal, and they don't limit the actual hip range of motion, and that's the key. The hip can get to the end range positions, then I'm going to progress them from this exercise program. Here, this would typically mean we're going to transition the exercises from a from a pain or tolerance perspective to more one of building hip mobility and control.